I would say treat your social media as your business card and don't get hung up on views. I have a lot of times, people ask me like, listen, I posted this video and it's like got like 100 views, but it has so much value in that video. If you can help one person looking at that video, what else can you ask for? So I always say, don't get hung up, keep creating and treat it as your business card. And then the patients, the companies, the brands will follow.
Welcome back to the Med Creator 101 podcast. I'm your host, Dr. Dustin Portela, board-certified dermatologist, and I'm joined, as always, by my co-host, Mimi Banks, founder of MB Social. And we have a special guest on the podcast today. The first time we're bringing on a creator who is not a dermatologist. We want that variety in here. And so we are excited to welcome to the podcast, Dr. Ina Lazar.
So excited to have Dr. Lazar here. She's a leading expert in primary eye health and a top specialist in dry eye disease. She founded Greenwich Eye Care and the Dry Eye Institute, pioneering dropless treatments. Named one of America's best eye doctors by Newsweek in 2022 and a 40 under 40 honoree. She's also an ambassador of Sight Award recipient. As a KOL and co-founder of the Transparent Show podcast, Dr. Lazar educates on eye health beyond the clinic, covering beauty, fashion, and wellness. Welcome, Dr. Lazar.
Thank you. Thank you so much for having me. It's a huge honor.
Dr. Lazar, before we start, we always like to get to know our guests beyond their bio. You've done some amazing things, but on a more personal level, we've got kind of some get to know you questions, if you don't mind.
Sure. I love those. No, I actually get really stressed out, but let's go.
All right. Subway or Uber?
Uber.
Uptown or downtown?
Uptown.
Peloton or studio fitness class?
Only Peloton.
Every day?
No, 3 years ago.
No. Oh, okay. Iced or hot coffee?
Hot coffee.
I'm the same.
In the summer too?
Yes, because I only have double espresso early in the morning at like 6 in the morning and I don't have coffee again. So I just like my hot double espresso.
I like it.
That's impressive. One to last you all day. I pound them so bad.
That's when your eyelid starts to twitch.
Maybe.
Fair. You're not wrong.
Well, Dr. Lazar, we heard in your bio, you're a leader in dry eye disease and primary eye health, but you're also quite a star on social media. How did you get started in social media? Tell us about your journey into becoming an educator through the various social media platforms.
I look back and I really did not love social media until the reels started to come out in 2020. It was COVID. I actually was just starting my practice and I just had some extra time on my hands. So I just started playing with the creation and it kind of took off. I did not plan for it, but I'm grateful for it.
Was your plan just to help bring patients in the clinic when you started posting, or what was the objective when you decided, I've got this free time, I'm going to create some content?
No, I actually didn't even think that was even possible, that when you start your social media, you actually doing it to bring the patients in. I was looking at social media as a tool to educate people. I just wanted to share the things, the tidbits and myths, like myth busting things about eyes that are just wanted to people to know, because I keep repeating myself in the exam room with the same thing over and over. And I thought, what if I just make a video and have everybody watch that video, that I don't have to waste my chair time on explaining the same thing. So that was my main goal.
Yeah. When you say you didn't like social media, what encouraged you to push yourself and put yourself out there? Like, was there a moment or something where you said, I just got to do this?
I did few videos and I really enjoyed. Some of them were like funny videos. Some of them were educational videos. And I got that dopamine rush of enjoying the feedback. People were commenting like, oh, I didn't know that was a thing, or, oh, this is hilarious. And I kind of got really into it. It was not like premeditated. It was very natural, very organic creation.
And I'm sure that's part of why you've been successful, is you really just enjoyed the process of it. You didn't go into it thinking like, I've got to get followers, I've got to get comments and shares and likes. It was really an organic desire.
I didn't even know that was a thing. I was just like, well, few people are posting. I want to do it too. I have extra time. I didn't want to get anything back in return. I just wanted to share.
Do you remember like a first post that went viral? Was your feedback pretty positive right from the get-go, or did it take a little while?
Oh my gosh, I still remember that post. I still remember what I wore because it was such a big thing. It was such a common thing. This is that I discuss with my patients all the time. And I made a video about it. And it was like lunchtime. And then I turn off my phone. And then I hear like ding, 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 ding. You just hear all the comments are piling up. And I'm like, what is going on? To me, it's like, oh my gosh, breaking news. Something has happened. But then I opened it and it was just everybody was sharing the video, and it was about the myth about blue light glasses. Blue light glasses are very popular still. People are purchasing them because they think it's going to help them with eye strain on the computer. But there's really no literature backing that claim. So if you're working on the screen and you're thinking that by wearing blue light blocking glasses, you're doing a good thing, your eyes are no longer strained and you can just stay on the computer for 20 hours, that is not true. There's no evidence that they're helping at all. So that was my like a marketing. I said, it's just total marketing. Like, don't fall for it. Something along those lines.
Yeah, it kind of gives you a false sense of security, kind of like people that put on an SPF 100 in the morning and think they're good all day, kind of a similar concept.
Yeah.
So has your content evolved over time? Do you have to work and try to find new things? How do you know what works for you and evolve your content?
You go through stages. You know how it is. You have so many ideas, and my ideas 100% come from patient interaction. Sometimes patients say something to me. I'm like, oh my gosh, this is a great post. I'm going to make a note of it and try to make something out of it. But you go through waves. Sometimes I have like a creator block and nothing is coming out. I cannot post. But really, majority of the time, I try to just do better. Lately, I am consuming more than I'm producing, but I hope it's going to take a turn and I'm going to start producing more.
I mean, I think that is important to consume content as well on the platforms because you kind of know what the trends are or just what kind of content the algorithm is favoring, because it's really just trying to mimic human behavior to see how do they get people to stay on the platform more. And if you don't have your finger on the pulse of that, then it's really easy that your content will not perform well.
Absolutely. I do find then following the trend is one of the tricks to, kind of get the information out there. Sometimes I have a really good post and it's like, oh my gosh, this is so valuable. This is about diabetes. Like, I'm going to change people's lives. And it just tanks. And I'm like, wow, really? But then I talk about, the Demodex mites and it just goes like a whole different life. Having that trending audio, I think, does help a lot.
And have you found that you've stayed true to like your original objective of just being an educational platform?
Yeah, I really feel like that's just the most authentic to me. I just try to get their information out there. I try to educate people. I try to, make things easier for them. Sometimes I have a DMs like, oh my gosh, you made a post about not rubbing your eyelids, like rubbing your eyes. That makes so much sense because my lids are so soft. They're drooping now. And it's because I've been rubbing my eyes my whole life. It's like sometimes just some basic things that are basics to us can be a huge for somebody who's on the other side and listening and learning and consuming this. And I like to create funny videos. It's just, there's a fine line between being funny and disrespectful. And it's very easy for me sometimes to cross that. So I have to backtrack myself and you're like, okay, no, I don't think this is a good one.
No, I think it's important that when you're a healthcare professional of any kind, and specifically an eye care professional, that there's a host of information that of just like the basics, that's the fundamentals of eye care that the average person doesn't know. And so specifically when it comes to education, I'm so sure that there's treasure troves of facts, of myths. I mean, I didn't know that blue light glasses were a myth. I had no idea. Did you know that, Dustin? I'm sure you probably did.
I think I knew there was probably a significant amount of marketing behind it, but I thought that they probably helped a bit. I think I've looked at blue light glasses more as like just limiting the blue light before bedtime so your body can release melatonin. I didn't know much about the claims on eye strain itself.
If I were to ever prescribe blue light blocking glasses, number one, they need to be brand name. You can't just go to like any online place and buy them because they're very differently made. There's like a good quality and poor quality production, but I would only prescribe it to those people who are staying on the computer late at night and then have a hard time falling asleep or staying asleep. That's when I will say, listen, I think you should consider doing this. But even then, there are ways around it. You can make adjustments on your phone. You can turn off the blue light on the phone. You can turn off the blue light on the screen. So there's always ways. You don't need to invest into a blue light blocking glasses. If you have extra money, I think there are other things you can invest in, like good SPF, right?
One thing that I just recently learned from you for preparing for this was about how eating small fish helps maintain healthy tears. And that's something that you spoke about on the Drew Barrymore show. I wanted to spend a second to talk about that, fangirling about Drew Barrymore, being on TV, what that was like, and then we can talk about eating small fish.
It was honestly the best experience. She is just so normal. I find that just being normal these days is a very good quality in people. No, she was just very, very kind, very welcoming, very warm. She like hugged me. She made me very, very comfortable on that couch. And she also has a dog that always there with her. You just couldn't see the dog. And I wore this black dress and the dog constantly tried, because I have a dog in my house. So I think her dog was smelling my dog on me. And he just like kept licking my thighs, my knees. And I was like, this is so distracting. I felt like home. Like I honestly felt like I was home with her. We're best friends and we're just hanging out on the couch. And I think that's really the goal of her show.
Do you think that being a creator, the fact that you make videos very often, that you've been doing it for 5 years, did that help ease your comfort level to being there, to knowing that this is going to be broadcasted on TV to millions?
1,000,000%. I think if it was, 2020 and I was just taken out of my office and put on Drew Barrymore's show, I would probably not even open my mouth. I would be mute. I would not be able to say anything. So yes, being on social media opened up so many doors, which I didn't even know I wanted nor needed in my life. But, you put a lot of work into building your social media. You're doing a lot of research. This is like a second job to me. I see patients and then I come home, I take care of my family. And then at night I would consume, save some videos, save what I want to do the next day. Creating these videos allowed me to rehearse my language, rehearse what I'm going to say, rehearse things. So when you ask me, I already been practicing. I already know what I would say versus before. It's different. English is also not my first language. I'm still learning English. Every day there are words that are thrown at me. I'm like, all right. My son is in first grade, and sometimes he brings home words that I have to research so I could help him understand. So absolutely, creating videos helped me deliver the message better.
Dustin and I talk about that all the time, about how then you have a new level of awareness of yourself, how you look, how you come across, how you want to look, how you want to come across, just because of the experience that you've probably had.
Oh, absolutely. I didn't even know I had a good side and a bad side. Now I do.
So what's the good side?
Feels like for majority of people, the good side is the left side. Right, Dustin?
Yeah, I think so. I would agree. One thing that I've noticed having done, I did the talk a few years ago and have been on a couple of professional shoots, is you see the way the crew works and the way they do their cameras and the lighting and all those things. And I'm curious, because I know how it's impacted my content creation. Your experience being on a set like that, has that changed the way you make content on your own?
I think I realized how important the lighting is. Everyone on that video, and sometimes we just took out our phones and we took a few selfies. Just having good lighting is like 90% of the job. Everybody looks good in the good lighting. So don't underestimate good lighting.
Did you make any changes to your setup as a result of that experience?
That's so funny you said that. I did. I usually would do my videos with the bright blue light, like a white, but I realized the warmer tones are more like aesthetically pleasing. So I switched my light to a yellowish light now.
Interesting. Very cool. A little tip for the listeners. from professional sets.
Exactly. Oh, I love that nugget. And speaking to what you've learned across the years, I think that what you've done very seamlessly is how you built relationships and long-standing relationships with brands. For example, we were talking about Uptaste. And those of you who don't know Uptaste, Uptaste Life is a range of eye care beauty solutions specifically formulated for dry and sensitive eyes and periocular skin. And they recently came out with new products that I think will interest Dr. Portela. They have a sensitive eye makeup remover and a sensitive eye daily renewal cream, and are eye doctor and dermatologist approved. Uniquely formulated with ionized water to be effective, preservative free, and gentle for those with dry and sensitive eyes. So, speaking our language. With that in mind, what we wanted to do is to learn more about your authentic approach and how you've developed relationships with brands like Uptaste and how you work with them, knowing that it's for the long game for you, which is education. A lot of people in the creator space work with brands because they want to get partnerships. But that shouldn't be the case because you want to promote brands that you actually believe in.
Oh, absolutely. I think we need to approach our social media as our new ways of business cards. When I schedule an appointment with a doctor, I go on their social media. I want to see what they look like. I want to know what they offer, what they speak like, what their bedside manner is. And that's how I will keep that appointment, or I will choose to have an appointment with that doctor once I see them on social media. So same thing goes for the brands. When you are on social media and you're talking about what you're talking, and that's something that aligns with their vision, I find that social media opened up so many doors for me, and I'm so grateful for that. It's a lot of work, but it does pay off.
And so, with specifically like Uptaste, they're a brand that comes from Ireland. How did you find them and how did you make the choice to talk about them?
So they actually found me. After opening my practice, I specialize in ocular surface disease and dry eye. And we're always looking as providers to offer good quality product that will support our patient's ocular surface, not strip the oils. Because when you treat dry eye, we want to preserve every tiny bit of that oil to lubricate the eye. And you need products that will allow that without causing other issues. So for example, a lot of moisture drops, they have preservatives in them. And when patients use moisture drops frequently, and it's usually, more than 4 times a day, that can cause unwanted side effects. So for me, I was looking for brand that is safe to use multiple times a day, but is also has so many other benefits. So I actually offer Uptaste in my practice a whole line of products. I also love their makeup remover. I think it's one of the best things I've ever tried. I use it like on my face.
And it was exciting to learn about it and how they're doing that to not have to rub. I know with normal eye makeup remover, I'm constantly rubbing, constantly like patting to try to get it off. And this is specifically formulated with eye care professionals to avoid all of that rubbing and like really target the sensitive skin and treat the skin.
Yes, because as the skin around our eyes is so, so, so delicate. And if you constantly keep rubbing that skin over time, there will be, you'll see what happens. Broken collagen fibers, the skin is starting to loosen up. And that's when you start seeing the lines. So with this specific eye makeup remover, it works like a magnet. So you just put a little bit on the cotton pad, you hold it, and then you lift it off. It's mind blowing. I personally love it because it's not stripping the patient out of the oils and they don't need to rub their eyes, which is a no-no in the eye care world.
Makes me sad that I don't wear makeup because I kind of want to try this product.
I love the analogy with the magnet because that gave me such a visual. And I think that that's the power of the content that you create, that you're able to simplify something that has more complex science or ingredients or just even the effect. But how someone like me and like now Dustin wants to wear makeup just so he can use the product.
I wonder how it does on sunscreen.
You can totally use it on sunscreen. I use physical sunscreen with tint. And, sometimes it's like you have to rub that thing off. So I actually do use it. I use it all over my face, honestly. It just runs so quickly. It's like 2 weeks, the whole bottle is gone.
I got to try it for my sunscreen then.
Put it to the ultimate test. Waterproof mascara and sunscreen. And speaking of updates, you're also on the advisory board. So, what I think is interesting here is that when you're a creator, so you learn how to create to prepare you to be on the Drew Barrymore show, you can help you figure out that you want warm lighting. But also, it doesn't necessarily always mean about sponsored posts, but you can participate with brands by being on an advisory board, by consulting, by helping with product development. And then sometimes there's creating content, but there's so many different ways to work with brands.
Oh, absolutely. There's just so much need. And what I like about partnering with, let's say, skincare companies or makeup companies, because they need to be aware of eye health. A lot of times you talk with the dermatologist, which I get, but nobody talks to eye doctors. And there's so many things that go wrong with all the ingredients that are being put in eye makeup. And just recently, the retinol, I don't know if we're going to have, a fight with Dr. Portela right now, but, when you advise patients to put retinol, where do you have them put it on? Do you have them put it in the periorbital area? What do you tell them?
I always tell my patients for their retinol, if we're treating, anti-aging or acne, not to get too close to the eyes or the mouth. That's what I instruct my patients to do. Now, there are retinol-based eye creams, which are a much lower concentration. And those I do let patients put right on the eyelid skin, but I do tell them not to take their face retinol on the eyelid skin.
You almost passed, but then you added the part 2 and then you failed.
Oh.
So, look, the new study shows that the retinols are actually negatively impacting the oil glands that we need to lubricate our eyeballs. And it makes sense, right? It increases cell turnover, and some patients have significant gland loss due to the retinols. So, what I ask them, because I use it too, listen, we're all going to be using it. Nobody stops it, but we're just going to stop at the cheekbone. I still have them to be very, very careful, especially those who already have significant gland loss, significant dryness. Like, don't pack it in the waterline, because you have to understand what we say and what patients hear are different things. So you tell them stop here, that means it's in the waterline.
So no retinol eye creams.
No retinol eye creams, but that's why then you have the Uptase Sensitive Eye Daily Renewal Cream. And what I thought was interesting here, but this one is with dermatologist and eye care professional approved. So it looks like this conversation is being had on a wider range. What I think is interesting here is this conversation about ingredients, is conversation about dry and sensitive eyes, which again, I think, in the dermatology world, which we speak to all the time from beauty brands, that there's a larger conversation from a creator perspective to be had. Eye education.
No, absolutely. How many times there's a new trend? Every dermatologist loves Vaseline or Aquaphor, right? Brilliant. Love it. I use it myself. But if you start rubbing that thing around the lids, that's how patients get styes. So again, there needs to be a better communication, I think, or better education even for the brands. It's okay to use Vaseline. Be careful around the eye area. We had a whole outbreak of teenagers coming in. It was like a 3 months block last year with the huge hordeolums.
So just like in the real world, where doctors need to do a better job communicating with each other when we're sharing patients, same principles go online, as we need to do a better job learning from each other, because there are those specialties in particular that have a lot of crossover, and eye care professionals and dermatologists share some pretty important real estate on the face.
Listen, you would be surprised. I was just at the event in New York City, and there was optometrists, there were ophthalmologists, there were oculoplastics. And I will say, from my standpoint, like, I treat dry eye. 85% of this dry eye, it is actually has nothing to do with the eyeball. It is the lid problem. So I am treating eyelids, which is part of the face. Majority of my day, I treat the lids, not the eyeball.
What I think is also interesting, again, going back to like med creators, is thinking about how you communicate and how you simplify the way in which that you're creating content, whether it's about the eyeball, whether it's about the products, whether it's about your personal experience is so, I think, important. And from what people are listening to here, you can hear how she's able to distill complex information down to be very simple. I am not a medical professional. I work with a lot of them, but just to be able to have somebody understand, I think is very important. I mean, that's a skill in itself.
Yeah, creating analogies, I think, is very important because a lot of times I can even tell, and I'm sure Dustin has that same thing. I try to explain to a patient what's wrong with their eyes when it's like a 10-minute discussion. It's like me, like a crazy professor trying to draw things. And I can see I lost them. Like, we're done. Like, this patient is so overwhelmed at this point. He may not even come back. And then I'm like, okay, I think I'm confusing him. And just making it very simple, your tear ducts are blocked, brings them back instantly. So it's okay to use, scientific language, but it's totally normal to have analogies or simplify for patients so they understand.
You got me with the magnet. You got me and Dustin with the magnet. I'm less familiar with a lot of the creators in the eye care professional field. If you had any advice to someone who is starting, who has seen you, they want to be like you, they want to either be on advisory boards, they want to do consulting, what is one piece of advice that you would give someone?
I would say treat your social media as your business card and don't get hung up on views. I have a lot of times, people ask me, like, listen, I posted this video and it's like got like 100 views, but it has so much value in that video. If you can help one person looking at that video, what else can you ask for? So I always say, don't get hung up, keep creating and treat it as your business card. And then the patients, the companies, the brands will follow.
Great. So if you're an HCP, you can purchase Uptaste products at a discounted wholesaler by reaching out to a local rep. We'll provide all of the details in the show notes. And for individual orders, you can use a special code and get 10% off of your first purchase using Uptaste 10. That's OPTASE 10. Uptaste products are also available on Amazon. We will list all of the details you need to get that magnet, to get off your sunscreen, and the waterproof mascara in the show notes.
Dr. Lazar, for those that are new to you, where can they find you on social media and also in your practice?
My social media is dr.inalazar on Instagram and eyeballdoc on TikTok. And I am in Greenwich, Connecticut. I actually have two practices. One is in Greenwich and one is in Darien. And you can always reach out, email, DM. I'm always open, always happy to chat.
Thank you. We'll make sure to include those down in the podcast show notes so people can come find you and get their dry eyes taken care of.
Oh, thank you so much. I would love that.
Dr. Lazar, thank you so much for being here and sharing your journey, how you build authentic relationships, and how you create content.